Thank you so much. Good morning, everyone. Thank you to all my colleagues for being here to cover this very important briefing. We have to talk about a very specific area of California that has been experiencing a high rate, the highest rate of COVID infections so far in California, and see what lessons we can learn from them and how the community has organized there. But first, to talk about a panoramic view of what's going on with the pandemic, we have, as usual, Dr. Tung Nguyen, who's going to give us probably the bad news. Dr. Nguyen, go ahead.
Hi, can you hear me? Yeah?
Yes, we can hear you. Thank you.
Thank you. Thank you for having me on to talk about sort of the overview, and I appreciate your work in getting the message out to our communities. So just as usual, my overall summary, as of yesterday, there are 12.1 million people who have COVID-19 across the world and over 541,000 deaths. We crossed a very significant threshold, 500,000 deaths from COVID worldwide. In the United States, there were over 3.1 million infections and more than 133,000 deaths. In the last 3 weeks, and I just happen to know this because I was not looking at this for 3 weeks, the number of infections in the U.S. has increased by 50%. Another way of saying this is that in the last 3 to 4 weeks, there were 1 million new infections, while in the preceding 14 weeks, when we thought things were bad, there were 2 million infections total. The number of new cases are rising in 45 states. In 13 states, the number of cases are at least 60% higher than they were just 2 weeks ago. In Florida, Georgia, Louisiana, Tennessee, and Nevada, the number of cases are at least 100% higher than they were 2 weeks ago. So if that sounds like things are accelerating in the wrong direction, that is correct. ICU beds are filling up as well. The following states have 70% or more of their ICU beds already filled: Arizona, Nevada, Texas, Georgia, Kentucky, Tennessee, Alabama, and West Virginia. Nearly half of the ICU units in Florida are already full. The death rates from COVID are also starting to rise in some states. I think you may have heard some argument that the number of cases are going up because we're testing more, but they're not so sick. That's actually not true. The fact that the ICU beds are filling up is one indication of that. The other is that the death rates are going up, and this is expected because you don't expect the death rate to go up until about 2 weeks after the new cases are going up. So we're seeing that now. Arizona, Texas, South Carolina, and Nevada in particular are notable for this. It would be reasonable to expect that we won't see as many deaths, only because now we have a couple of proven treatment that actually help. So I'm sure that hopefully doctors are using them appropriately. On the transmission front, a lot of scientists have been saying that COVID is being spread not only through droplets from coughs and sneezes, but also is airborne or aerosolized. This is actually a very important distinction because droplets, when you sneeze or cough, it falls down to the ground quickly, relatively speaking, and then it ends up contaminating surfaces and not stay in the air for so long. Airborne, when the virus is aerosolized into the air, it actually can stay there for quite a while, and it may still be in the air when someone else walks into where you've been breathing. The WHO, which has been fairly adamant that this is not the case, has grudgingly admitted, I think this week, that this airborne spread cannot be ruled out, particularly indoors. It doesn't really make a huge difference as far as the community is concerned, except that I think it just means that this thing is very infectious. We already kind of know that, but in the hospital, for example, when we talk about airborne precautions versus droplet precautions, we get revved up even more for airborne transmission. The good news for most people is that the mask will prevent either airborne or droplet transmission. But to date, only 22 states mandate mask wearing of some kind in public spaces. Notably, the governor of Texas just finally mandated mask wearing in public spaces on July 3rd, but only in counties with 20 or more active COVID cases. And Florida, despite its sort of increased numbers, still has not mandated mask wearing. One item I wanted to pass on regarding the prevention of transmission is the FDA has listed some hand sanitizers that are toxic. It needs to be disseminated to our community. What happened is that hand sanitizers have to meet certain standard of ethanol percentages for it to be effective. And these particular sanitizers actually has methanol, which is just one letter change, but it's hugely important because methanol can be absorbed through the skin and is toxic to humans. Basically, in the old days, people used to make moonshine, and that they make wood alcohol, which is methanol, and they drink it and they go blind. And so this is when you start putting sanitizers on your hand that has methanol, there are a lot of bad things that can happen. The reason why I wanted to highlight this was that it happens that all the products listed by the FDA with this problem were produced in Mexico. So it may be relevant to some minority communities. I will in the chat send you the link to the FDA document that lists all of these sanitizers. On the treatment side, I'm sorry to say that there are no new treatments that have been shown to improve COVID outcomes. I do want to note that just as the WHO stopped studies for hydroxychloroquine and another drug called ritonavir, lopinavir, because they don't work, President Bolsonaro of Brazil decided to take hydroxychloroquine for his COVID infection, which is to show that maybe our leaders and the science that they follow are not congruent. On the vaccine front, and this is the last thing I'll talk about, there are still 145 candidate vaccines. 22 are in human studies. The big news this week was that the NIH, National Institutes of Health, announced the creation of a COVID-19 prevention network to test vaccines and other types of prevention of COVID. They also launched a site, website where people who want to participate in vaccine studies can sign up. And again, I'll send that link through the chat. I took a look at it. It's all in English at this point. So I think for a lot of issues that are common to our communities, if our minority members wanted to sign up for these, there might be some issues. And certainly we can take a look at it and decide to send messages to the NIH to improve it. So I'm sorry that I don't have good news. I have pretty bad news, actually. And things are not moving in the right direction, and they may be getting worse. Thanks.
Dr. Nguyen, thank you so much. I know you have to jump off the call, but do you have time for one question?
Yeah, I have 5 minutes for questions. Yeah.
Oh, good. Okay, thank you. All right. So we have a question from Sunita. Sunita, go ahead.
Hi, Dr. Nguyen. As you know, as of this week, India has the second highest rate of infections, but it's managed to keep its death rate relatively low to about 25,000. It's got, the US has 1/5 of the population of India, and yet its death rate is 6 times higher. I wonder if you can explain that phenomenon.
That's a really good question. I'm not sure that I have the data to answer that question, but I don't know the quality or the reach of the Indian health care system. Our healthcare system is not good. So that's probably the first one. I don't know the age grouping of those who are getting infected in India. I know that the first wave that we're still in, a lot of older and people with a lot of comorbid conditions were getting infected. And that's where people are dying from. We do have young people dying from COVID, but not very many. And so, again, without knowing the age distribution and so on and so forth, it's hard to make a conclusion about across systems.
Thank you so much. We have a question from Famet Bakit.
Hi, doctor. How are you? I want to ask, what's the difference between self-isolation, self-quarantine, and physical spacing? That's one question. And the second, it's a quick, why we see that the whole world, it's more worry and warning about the COVID-19, but when it's come to the United States, we don't see that much, worry about that. People coming from all over the world, from the airport, they're not even ask them or put them in isolation or do anything. Could you tell me about that, please?
Yeah, so I think if I understand the question correctly, physical distancing is something that everybody should do to avoid either catching or passing it on. Whether or not you're at risk or not of getting COVID, physical distancing is the idea that you need to be at least 6 feet away from everyone. And in these days and age, it should be combined with mask wearing. I don't think we should do one or the other. We should do both. Isolation is really for people to contain them from spreading infection when they're coming from a high risk area or that they have been exposed. And that actually means you basically go in a room and stay there and really try to minimize as much contact with other human beings as possible. As far as sort of why we are the way we are, I think that's a pretty broad question. I think a lot of us don't believe things until we actually experience it. You hear very commonly that, oh, I don't know anybody who had COVID, so this is probably not something that I need to worry about. There's a very common thing that people do with their health until they know someone next to them who get it. They don't pay attention to it. That's pretty normal, but I think it's not been helped by the way that our leadership, some of our leaders have kind of talked about it, to minimize it, to basically put science and scientific recommendation in doubt. I mean, when you start doing that, then people who already are kind of tilted to not wanting to believe something will continue to believe it. So that I think is a thing. I can't say much about what the border controls look like at the airport. I don't know much about what's going on there.
Before you jump off, Dr. Tung, Sandy has a question for you. Now,
very quickly, Dr. Tung, we have learned that 15 cases from Imperial County were transferred to San Francisco. And I just wondered, what are the risks of transferring patients from that district?
Yeah, so you know, as we saw with the experience of this, the prison from Chico to San Quentin, anytime you send somebody who's infected to someplace else, that's a way to spread it. So it's incumbent on the healthcare transfer to make sure that the person is well isolated and that the people taking care of them are. I know that at UCSF we have dedicated units for COVID. So I think, you know, we try our best and we try to use all the best restriction, but that is a problem. I mean, when one hospital doesn't have enough people, enough beds, that's a big problem in and of itself. But then when you start moving them to another hospital or another area, that just sets up a potential route of transmission. So.
Thank you so much, Dr. Nguyen.
Thank you.
All right. Okay. Regarding the transfers, by the way, I want to say that I just spoke with Janet Angulo, the director of Imperial County Public Health Department, and I can provide an email for her, for the media that want to ask her this question. She told me there have been 500 transfers from Imperial County because there's only 2 hospitals and they're an underserved community. But I can provide her contact so you can talk to her directly if you wish. So we're going to move on with our next speaker, and that is Professor Edward Flores, Assistant Professor of Sociology at the University of California, Merced, who has some data to share with us. Dr. Flores, go ahead. Thank you for being with us.
Thank you, Pilar, and thank you, Sandy, for organizing this conference. The UC Merced Community and Labor Center recently, today, is releasing a report entitled Hidden Threat. And the report examines the role of the workplace in terms of the relationship between COVID transmission, in terms of COVID transmission across geographies. And so we know that 4 months after the nation's first stay-at-home orders, we still find ourselves continuing to debate the most appropriate way to mitigate the spread of COVID. And as you all know, these efforts have been largely unsuccessful. More than 2.9 million persons have been infected, more than 130,000 have died. And in addition to that, more than 20.5 million jobs were lost at the peak of the COVID pandemic job losses in April. But as public officials and experts have grappled with closing businesses and regulating public gatherings, a dominant narrative has emerged that COVID-19 has spread due to urban density, large public gatherings, and private behavior. These explanations are inconsistent with several patterns and surges. Recent analysis of 1.5 million CDC records of COVID tests found that during the period of stay-at-home orders, COVID rates fell for all groups except for Latinos, whose rates surged the whole time during